Performance-based financing simply means a paradigm shift from an input to result-based financing.
The health facilities around me that practice the performance-based financing, there are a lot of improvements there. Improvements in the area of equipment, improvement in the area of the way the health staff behave, improvement in the quality of services offered, that is a quality of healthcare that is offered to the clients at those health facilities where performance-based is practiced. If you compare to those health facilities where this performance-based is not practiced, you see a big gap.
It is a system whereby the quality of the services, whether this is in health or in education or in administration, comes first. Because providing services without quality doesn't make sense. And second, how are resources being used? And for that we have a number of incentives, like notably competition for resources, because the resources are always scarce. Once we have that, we have good quality, efficiency, then we can now try to exempt those patients or pupils in the schools which have no resources. So it is quality, efficiency, equity.
These health reforms are about adding a bit more money, but this money is added at the front lines where health facilities meet the population, the health centers, hospitals that treat the patients. This is where this money flows into. From every $1 put into PBF, about 75 to 80 cents goes in cash to the front lines. And this money then, what does it do? It pays providers. It gives the providers the autonomy to use the money to purchase drugs, to fix the problems, fix the watering system, buy equipment that's broken, hire additional stuff. It's money that's being used very efficiently and effectively at the front lines to get more results for the population.
It's a strategic approach to reform the health system, and it has to do with quality, output. It moves away from inputs to results.
It stimulates the system, the whole process, stimulates the system to respond better to the health needs. It promotes good provision of good quality services. What we see is you actually see results for the money that you invest, so you kind of get value for money for the investments that go in health.
The challenges of change in performance-based financing are fundamentally a challenge to try and get local, domestic funding to pay for PBF. PBF is usually paid by bilateral donors or maybe through a World Bank loan. That means that's money that's not coming from the government's treasury. And the moment it comes from a government's treasury, basically it's embedded in the budget, the annual budget, and then it's paid through local sources of income. And that is the fundamental challenge, to convince governments to start financing, start paying for PBF.
Health financing has been a great challenge. Sometimes supplies are not enough. They are not, they come, when we normally order for commodities, sometimes there's some delays, sometimes the commodities are also not enough. So periodically we may face some challenges of stockouts of commodities, but all in all we make sure that whatever the case, community members get the services.
The traditional financing is not efficient. That is whereby organizations and countries, they give the drugs on the health facilities, they provide vehicles, they build themselves the health facilities. Now the PBF way of doing it is that the health facilities or the schools, they buy those items themselves, and by doing that, so instead of centralized distribution and planning, and moving towards demand-driven buying of items, the efficiency gain is a factor 4. So you can with much less money you can achieve the same, or with the same money you can achieve much more.
The biggest issue at the regard of finance is, as you know, in Ethiopia structurally that is decentralization, but not in practical on the ground. Due to that, our respective regions are not autonomous.
Input system, where people base the activities on input instead of result. And this is a new approach that's resistant to change from input system to output performance.
Challenge is the issue of demand. You know, health service provisions need to be demanded, and in most cases, because of ignorance, a lack of awareness, a lot of services are not being demanded. We have to be struggling to mobilize the community, creating ward and village development committees to ensure that communities are mobilized to use certain health services. So the key challenges is demand by the recipient of the services we are providing.
Generally, we see a more accountable health system. So the health system is now more accountable to the people. The system works more efficiently, works more better, because in general, PBF principles are on the basis that more work should mean more pay. And so also the people will feel that they are being rewarded for the extra work they put in.
Health pass to autonomy. That is also a big challenge to change under the present circumstances. We need to engage with the various stakeholders, showing them the advantages, the best practices in those places that implemented. So through this, definitely we may reach some milestone in the shortest possible time.
When you want to change something, you are always facing challenges. And most of the challenges you are facing, this is to change the mind of people. The way they used to do, and now you want to change the system, how they have to do better. Though it's in the better way, this is your understanding, but then to give to others, I mean to make them understand this is the better way of doing things, it's not always easy. The first challenge might be resistance because of the change. Then this is resistance mostly, but based on values of the environment where you are working. People are not maybe accustomed to your way, what you are coming to, to install, and then trying to tell them this is the nice or the better way of doing things. So the first challenge is really to the attitude of people you are trying to, this is the most challenge we can face. But also challenges, how can you also identify people who is positive people, let me say so, positive people, because change is requiring not only one person, but then you have to be in a group, so that you have to make others understand, so that you can lobby for that change.
Challenge maybe the attitude change, because people are not fully engaged in the new reform. PBF is a reform, so it's also an acceptance of that PBF. Maybe it raises an issue of equity based on our country. So it may be the challenge of this PBF system.
One of the challenges I was thinking is to change the attitude. Changing the attitude of the people is not an easy thing, because it was a big challenge for us. And thinking of sustainability of the PBF, when implemented, it will be raised the conflict issues from other regions.
In my work, one of the biggest challenges I have identified is the change in attitude. Attitudinal change, and which PBF is also addressing, will, by the time the PBF principle is applied, will also help in addressing attitudinal change in terms of applying results based on performance. You are being rewarded based on your performance, and that is an incentive that could motivate a worker to do more. And by the time you work on attitude of health care workers, or at every level, you could see that there will be improvement in terms of productivity. Has some principle that at every level you could see that the government system are no longer working again. But once the government would decide to adopt the PBF, that's performance-based system in most of its sector, then there will be improvement in terms of productivity, and we could see that the economic will grow as well.
It also reforms the public sector in the sense that it applies the management principles of the private sector now in the public sector. Well, also it's very obvious that the private sector in most of our countries, we see they are more efficient, they run better in most of the instances. So why not adopt some of the good practices of the private and then implement also in public sector? Challenges in my work is sustainability, mainly because financing for the PBF program that we implement now come from external sources, and so for me I see that it is difficult for most governments to see that this can be sustained using local monies, local financing. So I think that is the biggest challenge. Next to that, I would say the political will to change the system in line with the PBF principles. I think that for me is number 2. Face the challenge of sustainability, mainly because the funding is external and not indigenous funds, and so also a lot of our governments see that it's expensive, and so you have to have money externally to be able to finance such programs. But also we have some, well, maybe to say it's mildly political reluctance also to scale up such interventions.
These reforms, they take a long time and they're not easy, so it needs a lot of commitment and of course the moment a government puts in money, That's sort of the switching point where you say, okay, now this has great potential for, let's say you could be covering 50% of the country, you can start planning to cover the entire country.
The challenge is a long process, because if it's a new thing, it will take long. So when you are impatient, then you will not reach your result. So you have to be patient and then make others understand, so that you have a lot of good people who understand, and then you can move forward.
Of recent, I have faced a serious challenge. Presently, we are in some sort of a war situation where I work in the Northwest Regional Fund for Health Promotion, and one of the activities we carried out is the distribution of essential medicine. It is the control, the supervision of health facilities. And around this period, it has been very challenging because, first of all, the roads are blocked by the cessationists, and then it is very difficult to reach some of the areas. Some of the health facilities have been shut down. People have been displaced. They don't want to stay in their own villages. They are hiding in the bushes, and if they are met in the bush, there is no way, they cannot really receive health care. Somebody who is sick, you cannot access the health facility. When you reach the health facility, you are not going to meet any health personnel there. All of them have escaped to the safe areas, abandoning the health facilities. And then it is also difficult to carry medicines, essential medicines, to those facilities because of roadblocks. You are being threatened along the highway by the cessationists and the other groups. So it's really a sympathetic situation. You can see a pregnant woman is unable to access health care. It's very, very difficult. And children are starving. Children don't go to school. There are days that we don't also go to work because there is no means of transport. And when you go to work, there are gunshots around. There's a lot of trauma. People are so traumatized. People don't live in peace. We live a lot in fear.
The environment under which change takes place should be the right environment. Once the environment is off, change cannot really take place and be sustained. Personally, in my place of work, I have the challenge whereby the environment and the government and the socio-political environment is not as conducive for change to take place. And in a situation of war, like is in the case now in Cameroon, in the situation of war, we have had to adapt to various conditions in order to be able to sustain change. And some of such adaptations have been unimaginable, but then our prerogative here is to ensure that the positive changes that must take place should take place. So we've had to go through all the things that we need to go through to ensure that there is a positive impact. And some of which I could tell you, there has been normally we get to verify registers and conducive atmosphere in the health facility, in offices, but now we are forced to be under trees, on the road, where we think it's safe and nobody gets shot and stuff. Those are things that one should be willing to do to ensure that the change takes place. Yeah, so in my line of work, I think I've been working now for 6 years, but this is the biggest challenge I've faced, to be able to make an impact.
Activities. So if I'm given chance, I'll put all my energy in the community, working with the community to avert the burden of diseases, to avert many things that people can. We are in the developing world, but we still have a lot of challenges, whereby if I'm given that energy and power, I can go and sit in the community to make sure that to assist because I cannot force things just like me as a person, but to be in the community, to assist the community, know their rights in terms of healthcare service delivery.
As far as challenges are concerned, I think we as politicians, we are very much used to challenges, and we're always ready to face challenges and get over the challenges. So as far as any program is concerned, we don't have, as a commissioner, I don't have any issues with facing challenges. So whichever challenges that comes, we face it squarely and get over it.
I see Africa as a well-endowed community. So what baffles me mostly is the fact that we still crave for donors to come. So I keep thinking, can't we do it by ourselves? That's the question.
What we have found over the last 6 years implementing performance-based financing in a handful of states, by the way, in Nigeria, is that it stimulates the system, the whole process, stimulates the system to respond better to the health needs. It promotes good provision of good quality services. In a nutshell, what we see is you actually see results for the money that you invest, so you kind of get value for money for the investments that go in health.
We are going to get changes in the near future.